There are hedge fund managers making $1 million an hour. You know, it's crazy, right? It's money everywhere. It's money in everything. I want to help you. Start your business today. Come join my royal family. Subscribe to Casino is the Name. Hey, yo, what's going on right now? You watching Casino is the Name. I'm sitting here with PJ and Jada Lashae, and they're two healthcare professionals. PJ is on the research side, Jada is on the clinical side. So I wanted to just kind of introduce the different sides of healthcare to you guys, because I'm kind of new to learning about the research side, but well, most of us are pretty familiar with the clinical side, but I wanted to just let them kind of explain the differences. So Jada, you want to talk about the clinical side?
Okay, so on the clinical side, you deal more with the patients and their families, and you're pretty much hands-on a majority of the shift with the actual patient versus
on the research side, where how the clinical nurses or any other people in the clinical field, they're spending 16 hours a day with this individual. We may spend merely minutes with these individuals, depending on the type of research that we're conducting. But our research is to help the ones on the clinical side with the different health disparities that they may encounter with the individual that they're treating at whatever clinical institution that they're at.
right.
So basically, I'm just kind of curious, what are the paths to becoming, say, a person on the clinical side versus a person on the on the research side?
Okay, so in order to become a clinical nurse, you have to enroll in a college, of course, and then apply for a nursing program.
So basically, you're on the nursing side.
Right.
Okay,
correct.
I just wanted to clarify.
Okay.
All right.
But yes, you have to apply for a nursing program, and throughout that program, you go to different clinical settings such as OB, mental health, med surg, and other different specialties. But during that process, you kind of decide which avenue you want to go on after you graduate. But once you graduate, you don't necessarily have to be a clinical nurse. You can actually become a research nurse. It's just a part of the process, just in case you decide to become a clinical nurse.
So basically, on the nursing side, you got to apply for a nursing program.
Right.
Get accepted. Then do you take boards?
Once you graduate, after you finish, you have to take an exit exam before you graduate. Once you pass, you do have to apply to take state boards. And once you take state boards and you pass, of course, you get your license, and then you're able to practice in the state that you took the exam in.
And what type of education do you need? Do you need
You can have an
associates?
associate's, right?
Okay.
You can have an associate's, a bachelor's, but
So you can be an LPN with what?
an LPN, I want to say that's an associate's degree.
You don't know.
I'm
right?
not sure.
Okay.
Right? Yeah, I'm not.
But
really
for
sure.
RN, to be an RN, you can become an RN with just an associate's degree.
Right.
Don't actually need a bachelor's, but there is a bachelor's degree, a BSN,
Correct.
right?
Correct.
Okay. So, and then on your side,
So on my side is many different ways you can get into it. Like how she was just saying, yes, there are research nurses, but majority of the ways that we've seen people get into it is you can get a bachelor's in a research field, like your different laboratory sciences, and then pursue the different type of certifications, and also have the work hours to match those certifications in order to get to become certified. Let's just say simple one, for instance, that I'm pursuing right now is the clinical research coordinator. So you can coordinate all the clinical trials to help with the different health disparities that are going on in the world, depending on what's your desired research. So with that, you have to have at least 3,000 hours of work hours. But also, if you're doing it through the ACRP, you can also get it with 1,500 hours of educational hours based on the educational institutions that they allow the hours to come from, and then another 1,500 hours from work. So you can split it up in that way. But in order to get one of the higher certifications, which is the principal investigator, you have to get an actual doctoral degree. So you're looking at anywhere from like your PhDs, your MDs, any type of professional degree. You can do that, and you can also then become fully immersed in clinical research or any type of research that you would like to do.
So what's the earliest level of education that is acceptable for being a research?
Your bachelor's degree, because you can. I think with your bachelor's degree, if I'm for sure through the ACRP, you can become a clinical research assistant, and then then you can kind of work your way up from there.
Gotcha. Okay, so what are the types of career paths on the clinical side? Like I know nursing is one, but even going into detail on nursing, like what's the first level of kind of working in the nursing field? Is it CNA? Is it something else? Like what is it?
Okay, so you have CNA, which is a certified nursing assistant, and you actually have to take a state board for that as well. Well, a state test for that as well. And then you have a nurse tech, which is what you do your second semester of nursing school. You have to be in nursing school. It's a step above a CNA, but you're not licensed. So you have to be a student, but you basically get to shadow an RN on the floor. And then you have your LPNs. Okay. And you have your RNs, and then move forward to nurse
LPNs
practitioner.
Are licensed. That's the first level of licensing?
Mm-hmm. Okay. Licensed practical nurses are LPNs, and then you go to registered nurses. So as a registered nurse, you can go back for your master's in order to teach, or you can go back and you can become a nurse practitioner. They're pretty much, I don't really know how to put it. It just depends on what your end goal is. You can also go back and become a CRNA, which you work beside an anesthesiologist. So it really just depends on what specialty you decide.
Okay. And then of course there's like doctors as well. I'm not even gonna
I don't really know.
Yeah, I'm not even gonna ask you about it. Yeah. But okay, so and on the research side.
So on the research side, some programs have it where you can get your MD and your PhD at the same time. So they really use this as a factor of having medical doctors that can actually conduct research, and they can apply the research that they're conducting to the clinical scenarios that they're going to be in everyday lifestyle.
So what would those job titles be?
So I'm trying to think I'll put it this way. If you go on Emory University's website, you can see the exact job titles and one of the exact programs that they have for that MD/PhD. It's a dual degree program. It's typically a little longer than going through regular medical school, because at the same time you also are conducting research
longer than medical school.
That's
interesting.
In a different health disparity.
Okay, so in your situation, because I'm only going to ask them based on their personal situation. In your situation, the job title that you're going after or the path that you're pursuing is called what?
So the job title that I want to obtain will be a health scientist, which, like I said, I don't need medical school for that. All I really do need is a PhD for it, and also getting the recommended certifications. So
there's a job title for it called scientist.
Yes.
Like a real scientist?
Because we specialize in the science of healthcare, and that's a broad range. Like I say, as a health scientist, you can be an immunologist, or you can deal with microbiology and pathogens. You can deal with genetics of the humans. Also, you can different health disparities that's going on. Like, let's say the carnivore. What it's called, the carnivore.
I don't even want to try it. You know, I'm gonna mess it up. So I couldn't even. Don't put me on the spot like that, cause you know what I'm saying. Make me look bad. You know?
Exactly. Hey, y'all have to be mindful that we are from South Georgia, so some words is kind of hard to pronounce.
Yeah, I'm like, they named it after beer or something
But
Corona.
That virus, a lot of health sciences, we're trying to figure out different ways to combat these different health disparities. Like malaria in countries like Africa and places like that. We try to figure out the best test for testing these viruses or these health deficiencies.
So you see this young black man is out here about to be a scientist. First of all, I used to see that on cartoons, like they'll talk about scientists, but I never met anybody who's an actual scientist who would say, yes, I'm a scientist. I didn't even know that was like I never really thought about it, I guess. Like, what is that?
Laboratory.
I never really thought about that being like a real thing. I just thought that was like a title people put on people who were like testing chemicals or something like that. I don't know, but that's interesting. It's an actual job. Like, okay, all right. So now, financially, this channel we talking about money. You know, we talking about money.
So let's be real. Okay, I'm gonna be real. Okay. So as nurses, you see nurses do a lot of work. Nurses spend a majority of the time with the patients as well as their families. I would say a traveling nurse can make just as much as a doctor if they wanted to.
Sheesh.
But I do feel that nurses are underpaid.
You feel nurses are underpaid?
Yes, I do. Because doctors can come in for 5 to 10 minutes and see the patient and then kind of, I'm not going to say disappear. I don't want to say that.
No,
but they don't spend as much time with the patient as a nurse.
Right.
I agree that nurses are underpaid. But I also agree that once you depends on the level of nurse that you get to, with your pay is going to increase matching your education. And that's the reason why doctors get paid a lot, because of their specialty during their residency. Because let's just say I go get my MD, which I'm not, but I go get my MD and then I go into public health and preventative medicine. Mm-hmm. That's one of the lower sectors of paid doctors. They're pretty much making a little bit more than a nurse practitioner. I think they make around $199,000 to $200,000 a year, which I've seen some nurse practitioners. I've seen some nurse practitioners that make at least $120,000, $130,000 a year. Mm-hmm. So you have to put that in.
Are you saying 99,000 to 200?
199,000.
199,000 to 200.
See, that's a lot. That's
okay. That's really good.
It is.
I mean, depending on what we're talking about, but
it's only because their specialty, it doesn't take as long to go through their residency compared to an orthopedic surgeon or someone like that who's making roughly $400,000 a year. And you got to put the expense on how much medical school is.
Yes,
also
that's why I was saying, depending on how we looking at it, it could be good or it could be bad. You know,
because with me, trying to eventually get my PhD, I can get stipends and get my education paid for depending on the school that I go to. They'll give me a yearly stipend between $30,000 to $40,000 a year. And I get a free education also there because I'm conducting research the whole time I'm there, which also helps with me getting out of school and getting the fellowships where I get more money, and then obtaining the big jobs where then you see the health scientists that make $150,000 a year, and one of the highest paid health scientists that make around $250,000 a year.
We was looking at one. So just to kind of clear the weeds on some of this, because I'm not medical or whatever, and just the basics. To get to become a registered nurse, minimum associate's degree. How much money can you make as what's the highest paid traveling nurse with an associate's degree? Would that be the highest paid category?
I would say it depends on the specialty.
It would depend on the specialty.
It depends on the specialty,
could be cardio,
and it depends
or
on if you
like
travel as well.
Gotcha.
So it's really all depending on what you want to make.
What are you seeing travel nurses making first year?
Like on an average.
I mean, I can't speak on travel nurses, but I know first year nurses come out making between 60 to 75 a year. And that's just a first year new grad.
With an associate's degree, possibly associate's degree, some BSN. First year, $60K. You.
See, My career is
the education requirement is deeper.
Exactly.
And how does it first year starting?
Let's just say you get your bachelor's and you come out and as a clinical research coordinator because you got your certifications. In a perfect world, you got your certifications while you was actually getting your bachelor's, and you come out and you get a job as a clinical research coordinator. You could make, on average, around like $52,000 a year, which is good coming out with a bachelor's degree for most instance because most people coming out with bachelor's degrees don't make that much.
Unless you're in the financial sector.
Exactly. Unless you're doing finance.
Which I am. Just saying.
But with research, the higher degrees you have, the more reputable you are, and the more money you will get.
Okay, so it sounds like they're paying the clinical people more.
Yeah, coming out.
Yeah.
Okay,
and then based on education, like I say,
because if you got a PhD, you technically a doctor. You are a doctor.
You are a doctor, but we're just not medical doctors, so we can't prescribe medicines and things of that nature.
So even then, because of the medical side, because of clinical still is going to trump the doctor on the PhD side.
And it all depends on how you look at it. Yeah, finances it will, but then you have liability insurances, things of that nature. Some of that stuff that I really ain't got to worry about. Right.
On
my side.
Yeah, I'm just trying to get the basics down. I'm assuming I don't know which lifestyle is better because you're dealing with people's lives here versus you know.
Well, we are dealing with people's lives.
Because y'all testing people.
We're the one who's testing it. And
that's right. They testing people,
giving them the information. But the thing is, you can test and give somebody something, but it's up to them to apply it. And when they apply it, they are more liable than we are in my eyes. Don't get me wrong, because let's just say I give somebody a blueprint and they skip a step on the blueprint and then boom, this person dies. Now this doctor's license is at stake.
Right. But it's your job to find the blueprint. So you can make those mistakes.
So I can make those mistakes and I can justify the mistakes that I made in my research. And then I'll say, okay, well, I had a false positive on this ELISA test. And this is the reason why. Because I didn't flush my specimens out with wash buffer the correct way or for the correct amount of time. Or the incubation time went over 0.6 seconds longer. And I just justify why my knowledge didn't go as according, but then I have to go figure out the more so perfect landscape for the knowledge so the doctor can get it.
Okay.
Well, I hope some of you guys understand what this stuff that these guys are talking about, and this is good information for me. I just like to learn about stuff, so this is cool. Anyway, do you want to tell him? Or you don't want to tell him your Instagram yet? He don't want to tell y'all his Instagram.
Got to get a professional one.
He got to get a professional. He don't want y'all to see the real one. And you want to tell him your Instagram?
Well, mine is very social. It's not more like business type, but my Instagram is _pecantan, PECANTANN_ and my YouTube is Jada Lashae.
Right. Some of y'all might say pecan tan, but
we're country.
And he's planning to start a YouTube channel, but she is already a YouTuber.
I just got started.
So y'all go over, subscribe. You know what I'm saying? And we're gonna wrap it up like that. If y'all want to see more of these videos, get in the comment section. I'll try and have them back for more videos. Anyway, right now you watching Casino Is the Name, and we out. Hedge fund managers making $1 million an hour. It's crazy, right? It's money everywhere. It's money in everything. I want to help you. Start your business today. Come join my royal family. Subscribe to Casino Is the Name.